Good afternoon, everyone. So glad you're joining us today. We're going to get started in about a minute. Just going to give everybody a chance to log on. Okay, we are at the 2 o'clock mark. Well, hello, everyone. Good afternoon, and welcome to the April Ask the Experts. I just want to go over a few housekeeping points before we get started. We do have some questions already to get our conversation started with our expert, but if you do have a question, please put it in the Q&A in the bottom of your screen, and we'll be taking questions live. Also, the program today is meant to be educational. We cannot troubleshoot individual cases during the webinar. So unfortunately for that, we cannot give personalized medical advice. As always, talk to your doctor about any medical concerns you are having. If you need help, call 988 or visit 988lifeline.org. So without further ado, we can get started. Today, we're exploring the very important topic of mental health. As many of you know, there are unique emotional challenges that come with the diagnosis of GBS-CIDP or MMN. And our expert, Jane Hamilton, will walk us through tools for a mental health checkup, strategies to protect mental health, and resources and strategies for addressing any concerns. So we're very excited to have Jane join us today. Jane is an entrepreneur. She's an educator and author of the Caregiver's Guide to Self-Care. Hopefully some of you are familiar with that. She's been a registered nurse for over 40 years. She is nationally known as a speaker and a caregiver advocate, and we are so delighted to have her with us today. Welcome, Jane.
Thank you, Maureen. It's a delight to be with you.
So, Jane, we have nearly, I'm understanding, 200 people on this call. So obviously a very important and very hot topic of emotional health today. So I want to jump right in, and let's, if you would, just start by doing a very quick overview of what mental health means and what is the difference between mental illness or a mental health issue.
Well, first of all, I'm delighted to know that there are so many people who are joining us. I started out in psychiatric and mental health nursing many years ago, and at that point in time, there was such a stigma associated with mental health that people just didn't even want to talk about it. And I think that really the growth of advocacy organizations like the National Alliance on Mental Illness, which is called NAMI, or the American Psychological Association, they've done a lot to promote the importance of recognizing and responding to mental illness and mental health concerns. So what is mental health? It's really a state of well-being, and it exists on a continuum, varying degrees, just like physical health exists on a continuum. Mental health is more than just the absence of a mental illness or a mental disorder. It's emotional, psychological, and social well-being. It's that sense of balance that we have, that we are able to recognize and cope with the challenges in our life. That's where that balance comes in. It impacts on how we feel, how we think, how we relate to other people, how we make life choices, how we handle stress. It impacts our whole life.
Yeah.
And it is important throughout our life, from the time we're children all the way to the oldest days of our lives. And it can really make the difference between having a sense of wellness or not.
Yeah.
Mental illness is, there are over 200 diagnostic categories, just like we have physical diagnoses of an illness, GBS, CIDP, MMN. These are diagnostic categories, and the same occurs in mental illness. And a diagnosis comes from a clinician who has expertise or specialty in this area, and it occurs when the demands on a person far exceeds our resources to cope with what is in front of us. Mental illnesses can be short-term and episodic, arising from a crisis, and can send us into a mental health crisis, but then we can sort of come back fairly quickly sometimes. But other mental illnesses are chronic and long-term. And I think the other thing I want to address is what causes mental illnesses. There are 5 things that are important to recognize. One of them are adverse childhood episodes. Trauma and significant difficulty in our childhood can lead to mental illnesses. A second thing is biological factors. Chemical imbalances in our brain or in our body can lead to mental illnesses. Thirdly, the use of alcohol and drugs can generate mental illness and the consequences of their abuse. The fourth, a feeling of isolation or loneliness can lead to a sense of mental illness. And the final one that I want to emphasize is that chronic medical conditions can lead to mental illness. And when we look at the issues with which your population is dealing, those significant health issues can create mental illness issues for the people who actually have the diagnosis and to their loved ones. So that is my short overview of mental health and mental illness.
So it's important then to do a mental health checkup so a mental health issue does not turn into a mental illness.
Exactly. And so that an individual from a state of health can feel the loss of well-being, and by acting in positive ways can help to lower that level of stress, strengthen their sense of resources, and prevent a significant mental health crisis.
And I guess it's safe to say that everybody at some point in their life has had a mental health issue then.
Absolutely. We all find periods of time, sometimes they're short, sometimes they're protracted, that the challenges that we face are stretching us to the limit. And it is particularly in those longer term experiences with elevated pressure and demands that we do things on a regular basis to preserve our health and our well-being.
So let me ask, who should do a mental health checkup? I think you answered that, probably everybody. And what does that actually involve, that term, mental health checkup?
Well, I think everybody, as you say, needs to be aware of their own sense of emotional, psychological balance. And when we're getting out of whack, we got to do something. Now, there are individual sort of assessment tools that you can use as a self-check that are available from the American Psychological Association, for example, or some other websites. And I could probably provide you with a link to some of those if you'd like me to.
That would be great. That would be great. Anything that we're discussing today that needs a follow-up link or a follow-up resource, we're going to be putting in an email and sending it out to all attendees today. So don't worry about jotting websites down or books or anything that Jane might mention. We're going to put in an email. Also, I have been asked to remind you, if you have a question, please put in the Q&A at the bottom of your screen, and we will get to your question shortly.
That's great. So in terms of the mental health check, there is, I think, an individual responsibility to be aware of what's happening in our own lives. But for a true evaluation of a mental illness or development of a mental disorder, you need to go be physically assessed by a practitioner, as well as have your mental status checked by any number of different questions that they might ask you and assessments they might conduct. So a professional really is the one to make that diagnosis.
And there's plenty of them out there, and there's plenty of resources for that. With our particular community, getting a diagnosis of GBS-CIDP and MMN can really turn their lives suddenly upside down and really make them unrecognizable. They are experiencing extreme fatigue, financial issues, loss of work. There's issues within the family. There's chronic worry. So they really get, thrown off track. What we call it in our community is really adapting to a new normal. So how do they take the first step forward? How do they get their footing and really start adapting to this new normal? Any thoughts on that?
Well, yeah, the new normal, when I think about the new normal, I think back on joining you last October at your symposium, and Dr. Gottlieb did a fabulous presentation, and I wrote down a quote that he made because it really struck me. He said, emotions arise as response to life experience. What is leads to a change in what is happening in my life when I have this diagnosis. And then I have feelings that go along with that. And those feelings of that arise as a result of this new normal are really feelings of grief and loss. The sense that what was in my life is no longer, or major aspects of what was in my life is no longer, and I may not like it. So in that new normal, recognizing that you're in an ending phase, an ending experience, you're disengaging from realities that are gone. You're losing familiar ways of seeing yourself or your loved one, running your family life, living your work life, and that sense of loss creates a sense of disenchantment. I don't like this. I don't want this new normal. I want it to be the way it used to be. And so there can be anger, there can be depression, there can be exhaustion from all the feelings, there can be anxiety and confusion and a sense of loneliness because I'm going through this and my feelings are my own and nobody else feels my feelings. Nobody else can deal with those feelings. I'm the only one who can deal with them. And so there is a sense of isolation and loneliness that comes from that.
Yeah.
Maureen, one of the things that I thought about when thinking about this topic is there is loss and there is sadness. And one of my ideas that I would suggest is to let yourself feel the sadness. Because that sadness is the root of your compassion. I remember when my own mother had dementia, and that was a new normal I did not like. I've not had the clinical situation that your population is in, but it's another example of
sadness is
overwhelming new normal, and I was really sad. And during that time, I looked at the idea of compassion. And the root word for compassion, it's a Latin word, com, calm is with, and passio is the Latin for suffer. And my compassion was my ability or my willingness to suffer with my mother in her situation. And I think for folks who are going down this road, there is some value in feeling those sad feelings because it brings you together. It brings you into the presence of one another's experience, and it creates a ground from which you can then move forward together.
Yeah. And I think along with that sadness really comes a sense of isolation, especially for our group, because it's not just a condition, it's a rare condition. So they really don't have anyone typically until, of course, they find the foundation community and other communities, but they really don't have anyone who's going through what they go through. So Can you speak to a little bit about the importance of finding that community and staying connected with that community as it relates to mental health?
Well, one of the most important things for people to hear is, as we talk today, is that the strength that we receive from connecting with others is absolutely crucial. And so, however isolated I feel, I need to find ways to make connection. And one of the beauties of your foundation is that it is in this organization that people will certainly find others who do understand.
Yeah.
It's that lack of understanding that is almost as hard to bear as the pain of the health crisis. So, I think that research has proven that when we connect with other people, we are strengthened. I've just been reading a fabulous book called The Good Life, written by some Harvard researchers. And these people have done a longitudinal study with families, with individuals, I should say, to see over the span of 30, 40, 50 years, who among the group is healthiest when they get to be 80 years of age.
I love that.
And they said very clearly that the healthiest, the factor that leads to good health most significantly is connecting with other people, having good, healthy relationships. And so they can be relationships in your family, in your neighborhood, in your faith community, relationships with coworkers at work, but also relationships with the people in the foundation will prove, and I saw it when I was with you all in October, the energy that came from people being part of that group and being able to talk with one another. Those relationships are really crucial.
Yeah, and we do hear that again and again, and we see that when people come to our events, they may come in a little shy, and they're not really connecting that well, but by the end of it, they feel like they've made lifelong friends. So it is really important to stay connected with lifelong people. We also have monthly coffee chats, which are simply virtual coffee chats that you can join. Anyone can join. You register for it, you can join, and they're very casual. And it's just a way to see other people, maybe tell your story. Let me ask you this: telling your own story, telling someone your story, is that something you would recommend? And is that something you would consider healing?
Oh, absolutely, because that is sharing your own experience. It's being vulnerable and opening to another person. And when others can listen to and appreciate how we feel less alone. Nobody is going to bear the burden of your own emotions. Nobody is going to be able to wipe this situation away so you don't have to have it. But to know that there is somebody else who hears and understands and empathizes with, feels with, that sharing of my story opens me up to receiving compassion. Where others listen to me, then they're suffering with me. Whereas if I'm listening to others, that's the root of my compassion. Oh, excuse me.
No, go ahead. Go ahead.
I was going to say, I think about the importance of reaching out to other people. I think when we're exhausted, when we're overwhelmed, when we're feeling kind of depressed by what's happening, sometimes we just want to crawl into a hole, or crawl into bed and pull the covers over our head. And it takes energy sometimes to reach out. But when I think about the importance of connecting with community and how to do that, I talk about it sometimes when I do presentations, like thinking of your community like a well-stocked refrigerator, because your community of friends and neighbors and family and members of the foundation have energy and ideas and resources that they can that can feed you, but you have to first of all open the door and be open to, make yourself available to those people, get on the phone or the Zoom call so that you can hear. When I think about that stocked refrigerator, sometimes we need a lot of information. Sometimes we need somebody to give us a break. Sometimes we just need somebody to listen. And so, like with food, you reach into the refrigerator and take out what you need at the moment. Sometimes it's a whole meal, sometimes it's just ice cream. So, think about, what do you need and who can you get it from?
Yeah.
And the last thing I'll say, it's like, you don't go to a milk carton for eggs.
Yeah.
And don't go to the egg carton if you need a cup of milk. You go to the container that has what you need. Some of your friends are people who can listen well. Some of your friends are, come on, we can do this. Walk up. Yeah. Some of your friends have information. Some of your friends will come over and just help you do the yard work because you don't have the energy left to do it. Go to people who have what you need and ask for that.
Yeah.
Those are my thoughts. Yeah.
That's great. You mentioned in your book how to maintain your positive personal energy. And I think you just touched on it a little bit, but you give some practical steps here on how to really just keep your energy positive no matter what you're going through. And they're fairly simple. Can you go through that a little bit?
Well, I think what I would like to say about maintaining positive personal energy, we're not always going to feel positive.
Yeah.
But to do things that are self-care practices, healthy self-care practices, will help me maintain good health, both physical and emotional, and keep my energy up so that I can continue on. So what I think about when I think about ways to maintain positive personal energy, I think of a 6-pointed star. And there are 6 elements that make me and everybody listening on this program a whole human being. We have a physical body, we have emotions, mad, sad, glad, scared, feelings, physical, emotional, intellectual. We have our thought process, what we understand, what we don't understand. We have thoughts that can help us to stay on track, or, oh, you're just not doing anything right. And so we can be negative in our thoughts, but positive thoughts, I think, are important. So physical, emotional, intellectual. We have a social self, a self that needs to play, to relax, and to connect with other people. Physical, emotional, intellectual, social, spiritual. Some of us have a religious life, others don't. But there is always this awareness that there is a power beyond ourselves that is guiding the world. And so to appreciate nature or to connect with our higher power or God is another aspect of keeping my energy positive. And then the final one, the 6th point, I would say, is occupational. All of us have a work life, whether we're retired and we're maintaining our homes, or whether we're employed outside the home, or whether we're both employed outside the home and providing care to a loved one. We all have work, and to find ways to organize that work, to balance that work, to find joy and satisfaction in that work. All of those things are ways to have positive personal energy. And I've created a list, which is a checklist to see what I'm doing for healthy self-care. And I think we'll provide that to people in your follow-up email.
Yeah, absolutely. Absolutely. So something that's sort of tricky for our particular community when it comes to self-care. As a caregiver, they feel guilty for taking time to themselves because they are caring for someone that really has needs a lot of attention. And as a patient, they feel guilty because they don't want the caregiver to be spending all of their time caring for them. So can you specifically address the emotion of guilt when it comes to self-care?
Yeah. When I think about guilt, I think that there is healthy guilt. Like when I've done something really wrong, if I've robbed a bank, I should feel guilty about that. I've done something wrong. I've violated some kind of real important law or social expectation. But an unhealthy guilt is one in which I feel that I have an obligation that I should fulfill, or expectation about how I should be. And this is sort of disproportionate or misplaced. Who said that I am in charge of the universe and I should be able to handle everything perfectly? And if it's disproportionate or misplaced, this is not my responsibility. I didn't make this happen. I'm not responsible in reality, for this situation. It's not in my control. So my sense is that that's the kind of guilt that I need to say, whoa. I have a picture in my mind of us looking at a dog who's come into a room and he's chewed up the furniture, and you say, bad dog, you shouldn't do that. Because the dog shouldn't be chewing up your furniture. And we kind of do that to ourselves.
So
because we say you've done bad. And we have negative voices in our heads. Sometimes those negative voices come from other people too. They guilt trip us into saying, well, you should be perfect. You shouldn't have made this mistake. So when I feel that guilt, I think to myself, I need to challenge my perfectionism. I am not perfect. None of us are perfect. We realistically drop the ball sometimes. We realistically say things that we regret. We realistically neglect to do some things that we wanted to do, but we didn't get to. Those are things that I need to say, well, this is sort of, I got to give myself a break, I guess is what I'm saying, Maureen. And I want to suggest that people affirm positive self-talk, especially when we're going through a long and arduous illness that is so uncertain, that has so many frightening symptoms and possible outcomes. We need to positively talk to ourselves and say, stop the bad dog stuff. Okay, get rid of that. And say, I'm
your own best friend.
Yes, I'm doing the best I can.
I
am going to put this in God's hands. That's what I say. Not everybody would say that. But I would say I give myself permission to be human.
That's very good. That's very good. I think you hit the nail on the head too before with, I'm not responsible for the world. I'm not Atlas. I don't have the world on my shoulders. So I think it's very important for people to remember that. So Jane, I'm going to switch over to another emotion that a lot of our people feel chronically, and that is really stress and worry. And I'm going to ask a question that came in from our live audience about CBT, cognitive behavioral therapy, and how does that factor in with managing stress?
that is a highly regarded approach to therapy to help us grapple with mental health, mental illness, mental disorder problems, whatever you want to call it. Finding a reliable and skilled therapist to help with that's a highly recommended approach to dealing with the issues I'm sure that some of your folks are grappling with.
Can you explain a little bit what cognitive behavioral therapy actually is?
Well, you know what? I don't think I can really be the one to give that. I don't want to. What I know is not deep enough to be able to
answer. Okay. So
we all have to know the limits of our expertise.
Exactly. Right. That's perfect. That's perfectly fine. So on the notion of stress again, I know in your book you talk about staying centered, and I think it's great if you can go to a meditation class or a yoga class and you have some time to keep yourself centered. But what about when you're in a pinch and you're having a panic attack? How do you deal with that? How do you deal with not spiraling?
Well, panic, like many of the other mental health issues, exist on a spectrum from minimum intensity to a very intense panic attack. If you've got serious panic attack issues, that is something that you should see a clinician to help you with. But for people who are not at that end of the spectrum, but feeling their anxiety rise, and they, talk faster and talk louder and forget things and get short and I can't get a hold of my breath. One of the things to remember is breathing deeply is one of the most significant ways to deal with intense stress. Breathing deeply for 3 minutes a day has been proven to have a calming effect on your life. So when a person practices deep breathing, and there are links on the internet where we could give you a link to a video on YouTube for deep breathing, and you can hear somebody speaking softly for a few minutes, and you breathe deeply, and you can get calm. Turn on your favorite quiet music. Close your eyes and breathe deeply. You can do that on your own. You can sit in your chair in your living room and close your eyes and breathe deeply for a few moments anytime throughout the day and recenter yourself. Breathing is a proven technique for centering and coming down into calmer energy. So I would encourage everybody who's listening right now, me included, to take a moment and take 3 deep breaths. Let's do this together. Okay. Inhale. Now exhale. Inhale. And exhale. And once more, inhale. And exhale. Doesn't that feel good?
It really does. It really does. I'm a big meditator also, and I think it just 10 minutes a day, it changes the whole trajectory of your whole day. You just make better decisions, and like you said, from a center place. But
it has real impact on your physical health and well-being. Yeah. So I would say to people, you can have secular meditation. You can have religiously based meditation. It doesn't matter how you approach it, but we do know from studies that a meditation practice is good for your health.
Yeah, that's fantastic. And we have some apps, and I'm sure you probably have apps too that you recommend for people that we will put in the follow-up email as well. So another question from our audience: how do you deal with family members that don't empathize with what you are going through?
Oh boy, oh boy. That's a real
That's a
question.
loaded one. Yeah.
Yeah. Well, part of the reason I wrote the book I wrote was because I had family members who were not empathizing with what we were going through.
Oh.
And I spent a long time being very angry. I hate to have to admit it, but in fact, that was the truth. And, that's part of what led me to my image of the well-stocked refrigerator and going to get milk in a milk carton, and don't go to an egg carton if you want milk. If you go to somebody who doesn't have what you want, you're going to be frustrated. So I think one of the things that happens when we're caregivers is that we need to expand the universe of people to whom we go for support. And sometimes the most logical people, my sister, my brother, my cousin, my father, my mother, they should be helping me, but they're not. And so for whatever reason, they're not. You can have a family meeting. This is sort of an aside. You could design a family meeting and sit down with them and go through it and try to engage their support. Sometimes family meetings work, sometimes they don't. Sometimes if it's a complicated situation, you need a clergy person or a very wise friend to come in and help you lead that discussion so it stays cool. But when somebody isn't there to help you, find other people. And sometimes your greatest helpers will come from individuals who surprise you.
Yeah. Very, very, very true. There's one more question coming in, Jane. It's kind of a longer one, so I'm going to just pare it down. But it sounds like they are concerned with how to talk to your doctor if you are having a mental health concern. They said physicians give you questionnaires, but no one ever goes over them with you. Can Jane provide some info about what those questionnaires cover, and how can I talk to a doctor if I'm having a mental health concern? So I guess just a general issue with expressing to the doctor that you think you're having a mental health issue.
Well, I mean, this is sort of the milk in the milk pitcher and egg in the egg carton. Some physicians are strong in terms of their understanding of and comfort in dealing with mental health problems. Other physicians are less so. I mean, we're all different people. Often, I think what is being asked these days are some standard questions to screen for depression when we go into our primary practice physician. And there are standardized screening tools to give them a quick ability to assess the level of depression in a patient that's in their office. But the thing is that may not be their specialty. And there are therapists available who are very skilled at dealing with mental health concerns. So it may be that you need to ask around for referrals to mental health clinicians. They may be people who are social workers or psychologists or family therapists. Sometimes clergy people do counseling. Sometimes psychiatrists do counseling, and they are the ones who would prescribe medications if somebody needs medication for mental health. So finding a referral source is, I think, a critical thing for you to find. Don't let a clinician's sort of inability to respond at the level that you're looking for. Don't let that stop you. Ask other people, where have you gone for help?
And I think, and it's your primary physician is probably a good start. They may have a referral, but like you said, ask other people, definitely.
There is a national association, NAMI, the National Association of, let me find the actual name of this group, the National
That's all right.
Alliance on Mental Illness, NAMI. Also, your health plan will have mental health providers part of them, and so you could check with your health plan as well.
Yeah. And we'll put that also in that follow-up email. Another question, can you give us the difference between a psychologist versus a psychiatrist and medication or drugs versus therapy? What is the difference there?
Okay, so a psychiatrist is a person who has gone to medical school and the specialty they have chosen is psychiatry. Just like a neurologist is a physician who has gone through medical school and they have chosen the specialty of neurology. So psychiatry is a medical specialty. Psychiatrists are in a position where they can prescribe medications as well as treatment for mental illness. Psychologists have gone to school to study to be a psychologist. There are master's level programs, but most people who practice clinical psychology have PhDs in psychology. They do not, I don't believe they prescribe medication, prescribe medication. And so they often work in conjunction with doctors who will prescribe those medications. But just because they don't prescribe doesn't mean they don't understand how they work. They have a tremendous amount of experience in the field. They practice clinically by doing therapy. Some do groups, some do marriage and family counseling, some do individual counseling. They have different, frames of models that they use, but they're therapists.
Okay. And as far as medication versus therapy, so the medication a psychiatrist would prescribe, and you would go to either one, I guess, a psychologist or a psychiatrist for actual therapy.
Yeah, and I don't think psychiatrists as often actually do psychotherapy as psychologists do, but that is not to say they never do.
Gotcha.
And I think what I want to emphasize is doesn't have to be either or. Either you do therapy or you get medication. Some people get medication. They're feeling depressed or anxious. They can see their family practice physician and get medication for anxiety, sometimes for depression. But when there is ongoing mental health concerns, I think seeing a specialist is a good idea. And getting medication for a psychiatric condition, I think therapy can help gain understanding and can equip a person with strategies for dealing with their mental health issue.
Okay. So another question, and we're at about 45 minutes, just to give you a heads up, Jane. So can you discuss, and I apologize for the light that keeps going.
That's all right, not a problem.
Someone comes in and pops it on though, so that'll happen. Can you discuss PTSD, so post-traumatic stress disorder, after a GBS diagnosis, especially traumatic nightmares? Give any insight on that?
PTSD is exactly what it's called. There has been a trauma, and earlier in our session, I said one of the causes of mental illness is trauma, adverse childhood trauma, but we can be traumatized as we go through our lives and through into adulthood. So what we're learning in the past, I'm not sure how long, trauma has become sort of an ascendant model for looking at mental health issues. That trauma is something that happens to us and has an impact on us. And if we can figure out ways to cope with that trauma, we can equip ourselves with ways to handle that trauma, we can find our way through it. We know PTSD when we think about individuals who went to war, but there are traumas like a diagnosis and like your population experiences, and that is traumatic. And so to understand it in the context of trauma, I think is an empowering way to look at it, because it will focus an individual on, now what do I need to do to heal from that trauma?
Yeah, to actually call it a trauma, right? So are there any studies, or have you ever heard of possibly, if you're dealing with stress and traumas during the day, that it would help with better sleep or not having traumatic nightmares? Or is that just your body's way of kind of processing trauma?
Well, each person is an individual, so I have to be very careful here because I can't diagnose one person's sleep disorder, in a situation like this. But what I will say is that we do know that traumatic events can cause sleep disturbances.
Okay.
And if somebody is having a sleep disturbance, and if somebody feels traumatized, then I would encourage you to seek out somebody who will help you with that.
Okay. Great. All right. Well, I'm not seeing any more questions come in, but as we kind of wrap up, if anyone does have questions, please feel free to put it in the Q&A. And Jane, do you have any last final thoughts or resources that you'd like to share or talk about to our audience?
Well, just the things that I mentioned, the information about self-care, the 6 approaches to self-care. The other thing that I'm going to offer you is my help wanted checklist. Sometimes we get very overwhelmed with the amount of things that we need to do, and we're sunk by it. And my help wanted checklist, I call my tired checklist. So it helps me to think about who can I go to for to do some of the tasks I can't get to. I is for information that I don't have that I need. R is for respite, somebody to come in and give me a break so I can rest. E is emotional support. Who do I go to for emotional support? And D is who can I turn to help me make a decision? So I'll give you my tired checklist to help people think through, who can I go to? Who can I reach out to give me the help that I need?
Right. That's easy. Good to remember.
And I think, the last thing that I would say just in closing, Maureen, is that, mental health, it's the emotional, social well-being that we have in our lives. And when we encounter trauma and stress and difficult situations like the listeners here today are experiencing, these can impact our overall health and our overall ability to function in the world. So this mental health checkup is really an important thing for each of us to do individually, to keep an eye out for how are we doing in terms of our balance and our energy, and to find ways in my day-to-day activity to nurture my well-being, to protect my mental health by practicing self-care, by asking for help, and by connecting with the foundation. I'm going to go there because what everyone here is dealing with is so overpowering and overwhelming. And to go to have a community such as yours that has all of the expertise and information that they need, it's what a gift, what a beautiful you're all providing. And I would go there.
And I second that, of course. And also, I think it's important to do kind of a health check or a mental health check on each other. If if you're noticing somebody feeling sad or depressed, ask them about it. I think it's good to check in on each other. So I will ask if you could tell everyone, Jane, where they can get your book, The Caregiver's Guide to Self-Care.
Well, thank you. You're very kind to share that with everybody. This book is called The Caregiver's Guide to Self-Care, 2nd edition. And you can find it on Amazon or Barnes & Noble. And if self-care is something that you're interested in pursuing, I encourage you to read it. And be sure to enter 2nd edition, because the other one I wrote in 2011, and this is the new version.
Updated. Perfect. And it's fantastic. I highly recommend it. I read it over the past couple of weeks, and it's not just for caregivers. I can tell you that it is for anybody who's going through any kind of mental health struggles. So highly recommend that. I would like to say thank you to our sponsors today. And I would also like to mention that we do have an upcoming symposium. Our biennial symposium is in DC this year. There is no greater place to go to get that positivity, find that community, and to start you on your path to better mental health. So I highly recommend you check it out. It's on our website. It's GBS-CIDP.org. And thank you so much for everyone joining us today. We're being recorded, so this will be available up on our website in upcoming weeks. And thank you so much, Jane. This was a fantastic session with you. We really appreciate it.
My pleasure. Thank you.
All right. Take care. Bye-bye.